Welcome to Bones Anatomy. Today we are going to explore the superior view of a typical cervical, thoracic, and lumbar vertebrae and compare their structures. Using prepared images, I'll draw each bony landmark step by step to explain their differences and unique features. Let's start with the vertebral body. In the cervical vertebrae, the vertebral body is small and light, allowing for flexibility and reduced weight in the neck region. The thoracic vertebrae, on the other hand, have vertebral bodies shaped like a heart. This shape is a visual cue, as the thoracic region houses and protects the heart within the rib cage. Moving to the lumbar vertebrae, the vertebral body is the largest and thickest, resembling the shape of a kidney that you can find at the lumbar region. This robust structure supports the significant weight of the upper body and absorbs substantial compressive forces. Next is the vertebral foramen. In cervical vertebrae, the foramen is wide and triangular, accommodating the spinal cord, a critical structure for transmitting neural signals. In thoracic vertebrae, the vertebral foramen is more circular, reflecting the narrower spinal cord in this region. In lumbar vertebrae, the foramen is triangular but smaller compared to the cervical region. It's essential to note that the spinal cord ends at approximately the level of the first to second lumbar intervertebral disc. Below this point, the cauda equina, a bundle of spinal nerves, occupies this space. Now, let's look at the spinous process. In cervical vertebrae, the spinous process is short and bifurcated at the end, aiding in the attachment of muscles that facilitate head movement. In thoracic vertebrae, it is long and angled downward, overlapping with the inferior vertebra to increase stability and protect the structure. In lumbar vertebrae, the spinous process is short, thick, and nearly horizontal, providing strong attachment points for back muscles that aid in extension and stability. Next, the transverse process. In cervical vertebrae, the transverse process features prominent anterior and posterior tubercles and transverse foramina. The transverse foramina are unique to the cervical region, allowing passage for the vertebral artery and vein. Thoracic vertebrae have articular facets on their transverse processes for rib attachment, forming costovertebral and costotransverse leg joints. Lumbar vertebrae have simpler but sturdier transverse processes, which serve as robust attachment sites for muscles and ligaments. The lamina is a part of the vertebra that forms the posterior portion of the neural arch, connecting the spinous process to the transverse processes. It provides protection for the spinal cord from the back. The pedicle, on the other hand, forms the anterior portion of the neural arch, connecting the vertebral body to the transverse process. Together, these structures form the neural arch, creating a protective enclosure for the spinal cord. Finally, let's examine the superior articular process. In cervical vertebrae, it projects flatly upward, forming facet joints oriented close to the horizontal plane, which allows a wide range of motion, including rotation. In thoracic vertebrae, the superior articular processes are oriented in the frontal plane, restricting movement to lateral flexion and rotation. In lumbar vertebrae, they are nearly vertical and oriented in the sagittal plane, permitting flexion and extension while limiting rotation. These facet joints play a crucial role in guiding and restricting movements in each spinal region. We'll explore more details of these joints when examining the lateral view. Now, let's discuss the unique features of each vertebra. The cervical vertebrae have transverse foramina for the vertebral artery and vein, as well as anterior and posterior tubercles on the transverse processes. Another hallmark feature is the uncinate process, a hook-like structure on the superior surface of the vertebral body that enhances stability and prevents lateral translation. Thoracic vertebrae are distinguished by costal facets that form joints with the ribs. These include facets on the vertebral body and transverse processes, which create the costovertebral and costal transverse joints essential for rib cage articulation and respiratory mechanics. Finally, lumbar vertebrae's unique features include mammillary and accessory processes. Mammillary processes can be found posterior to the superior articular process in lumbar vertebrae. These structures provide additional sites for muscle attachment, enhancing stability. Similarly, accessory processes are located posterior to the transverse processes in lumbar vertebrae, further contributing to muscular support. Through this detailed comparison, we can appreciate how each vertebra is intricately designed to fulfill its specific functions. Isn't it fascinating to see how form follows function in the human body? Remember, function determines shape, and shape determines function. If you just watched this video, next time try to pull out the pen and pencil and follow drawing by yourself. And I truly believe that for anatomy, the best way to learn is draw it by yourself. Stay tuned for more engaging anatomy lessons. If you found this video informative, don't forget to subscribe, set the notification bell, share, comment, and like. You can also explore many more insightful videos on this channel. Thank you for watching.